Now it's time for Real Health Talks news and views with cancer nutritionist and neurodevelopment specialist Craig Stelflew.
In the category of lifestyle, arthritis is an inflammatory disease that is linked to other health conditions like heart disease and diabetes. Well over half of adults with heart disease also have arthritis. Rheumatoid arthritis is actually considered a heart disease risk factor. Half of all diabetics will also develop arthritis. Arthritis now affects about 36% of obese American adults. Exercise regular, watch your diet, go gluten-free, take lots of fish oil and ascorbic acid, and reduce mental stress to help overcome arthritis symptoms. In the category of food nutrition, like to eat? You are going to need pollinators. Insects provide pollination services to about 75% of crop species and enable reproduction in up to 94% of wild-flowering plants. There's a cocktail of multiple causes that are combining to kill off pollinating insects, starting with deadly GMOs, pesticides, diseases, climate changes, alien species invasions, and overfarmed lands. Pollinator declines are threatening both food supplies and the ecosystem functions. We have to eliminate GMOs now to save our pollinators, along with using organic farming methods to naturally strengthen our plants against opportunistic insects, rather than using pesticides that indiscriminately kill all insects. In the category of medical madness, medical radiation is running amok. One CT angiogram of the heart brings 16 millisieverts. Did you know that this is equivalent to 800 chest x-rays? Huh? How about a typical nuclear scan? Humming in at 41 millisieverts, it is equivalent to 2,000 chest x-rays. A lot of cardiology patients are treated to this cancer ray at least once a year. But radiation patients are never told any of this. In my opinion, this is a critical breach of doctor responsibility to the patient. If you want to measure the millisieverts you receive, simply wear a radiation badge professionals use when they work in a cardiac cath lab or in an x-ray suite. Medical radiation use is a runaway freight train. Don't just stand there on the tracks. Hold your doctor responsible to protect your health for real. Question all x-ray and radiological procedures. In the category of vitamins and supplements, you've heard me tell that folic acid is a fake version of folate. Methylfolate is a bioactive form of folate in the body that is required for DNA production. People who cannot convert the folic acid into methylfolate often have depression, symptoms of schizophrenia, muscle degeneration, myopathies, pernicious anemia, pseudo-B12 deficiency, cardiovascular disease, blood clots, and DNA errors. Methylfolate helps prevent DNA errors and damage during cell division. These actions are critical during pregnancy to prevent neural tube defects such as spina bifida. Methylfolate helps the body make neurotransmitters like serotonin, dopamine, and norepinephrine. If folate levels are low in an individual, antidepressants will not work to alleviate depression. Always take methycobalamin B12 with your methylfolate for the best results. And finally, in Real Health Talk News and Views Trivia, heavy metal, not the music, trivia. Blood sample data finds that up to 630,000 infants are born in the U.S. each year with mercury levels that are known to bring loss in IQ. Thank you for listening.
Thank you for joining us. You have been listening to Real Health Talks News and Views, featured every weekday on El Shaddai Radio. Join us for Real Health Talks weekly broadcast every Tuesday night at 7 p.m. Phoenix time.
If I could reach the stars